Dr. Khaimov, I would like to talk to you about dentures. There's a lots of people wearing dentures, 40, 50 million or so. And people don't like dentures because they get loose eventually. They have to put that gluey gum in it, and they're worried about losing their teeth when they smile at a Thanksgiving dinner and stuff like that, or at a party. Hard to chew on apples and stuff like that because it's just not nice. Now, there's this new thing called implant supported denture, and some people say that this is the eighth world wonder. It's phenomenal. Tell us about it. Is it, number one, true? How does it work? Why is it so much better?
It is a phenomenon because a lot of people don't like dentures in a way that it doesn't feel as regular teeth, because they cannot bite into apple as before, they cannot eat their steak as before, they cannot enjoy their food as before. So those implants were created to keep the denture in place, so people feel more comfortable with the denture in place. They are more confident that once they bite into an apple, the denture will not end up in the apple instead of apple in the mouth. And they feel more comfortable, they taste their food better, they can smile with more confidence, and they can enjoy their life as before.
And what's the principle behind an implant supported denture? How does it work? Why give me the big umbrella picture of how it works, how it's clinically done.
The implants are placed 2 to 4 implants are placed in a patient's mouth, and there are a key. It's like a male-female attachment with an denture and an implant. So it clicks in and locks itself in the mouth, and whenever you need to remove it, just unclick it and it comes off.
I see. So I assume that in the past nothing else was around than the denture. But now, for the last years, where implant-supported denture is obviously around. So anyway, I assume that people use a denture because of price versus implant, because everybody knows that denture isn't so good. Implant would be better, but it's a huge amount of money to put a half a dozen or a dozen teeth in it. You know what I mean? Now, let me ask you. So basically, an implant-supported denture has 2 or maybe 3 or 4 implants in it. Obviously, each implant costs some money. So, and probably 2 implants is still a little more shaky than 3, I assume, because if a bicycle and with 2 wheels versus with a little bit of a training wheel on it, it holds better. Am I right there?
That's right. That's right.
So let's assume a patient, let's talk money. A patient doesn't have money. Can he start with, I need to get a normal denture, but let's plan it so that in 3 months or in 6 months, I can put 2 implants in it, and then 2, 3, 6 months later, I can put another 1 or 2 implants in it, and I am like, building my way up, the way we maybe decorate, most of us people, when we get married, that's how we decorate our house or move up from an apartment to a house to, and then the house is empty and then we put furniture in it, and, eventually we have what we kind of like think we want to have. Can a person do that with an implant-supported denture?
Absolutely. We can start just with the denture without the implant. The patient will see that the denture is not as comfortable in the mouth because it doesn't have a good support. So we start with 2 implants. He gets a better support, but we explain that in his case or her case, it is better to have 3 or 4 implants to have a proper support and a denture, so the patient doesn't have to worry about a denture coming out. So, but if it is financially hard for the patient, we start slowly. We start with 2 and then add another one and then add another one. Anytime we can add a special attachment to the denture for that implant. It's not a problem.
Beautiful. And is it possible that some people who already have a denture, as long as I guess it's not super worn out and already super bad, that they come to you and then you can actually put a couple implants in it on that same denture, or does it require a different model?
As long as the fitting of the denture is good, then we can place implants with the same denture, yes.
I see. Well, obviously, an implant-supported denture, so you're really saying you can bite into an apple, you can chew on a spare rib, and for all purpose, that's all you can do with normal teeth. So you're saying no more worrying and holding your hand in front when you laugh, and when you, none more of that. You're socially, completely,
no more of that.
Beautifully acceptable.
Exactly. And no more gooey stuff coming off your mouth that's hard to clean out.
In fact, there was just a news. There's currently a news investigation going on, or an investigation going on, which made it in the news, where that gluey stuff seems to be full of chemicals. And there's this one thing, which is actually a good thing, but if you have too much of it, zinc, then apparently some people get actually nerve damage from it. It's not proven. And I'm sure the glue companies...
It's not proven yet, but it is not proven yet, so I cannot discuss it in more details, but all those glues, all those creams that hold the denture in, it's not comfortable for the patient. It does hold the denture in, but whenever you need to remove it or clean it out from your mouth, it's very uncomfortable, very hard to do.
Right. And that's gone. When you have an implant-supported denture, that's gone.
It's gone. You don't use it at all.
Gorgeous. And of course, you can make the denture like you would be a veneer or lumineer. You can fit it to the person's, so he or she looks just absolutely gorgeous, right?
Absolutely, yes.
Well, wonderful. And what about tasting the food? You did say something that you can taste the food more. You know, the normal denture has this suction on the top of the palate, which basically inhibits, because that's where we taste the food. So with an implant-supported denture, is that part of it gone, or is it still there?
For the top denture, no, it is still there, but because it has that suction in all the time, you can still taste the food better, because your tongue also has taste buds, and so you can still taste the food normal and not worry about the food getting under the denture, where it gets very, very annoying.
I got it. Wonderful. Thank you very much.